Welcome back to ALECTV. I'm Tom McLaughlin here at the 46th ALEC Annual Meeting in Austin, Texas. And I'm here with JP Wieske from the Health Benefits Institute. JP, how you doing today?
I'm great. How are you?
I'm awesome. I understand that you guys are doing some work with the HHS task force here.
That's right. We've got a number of issues. We've seen states try to restrict consumer choice in a variety of markets. Limited benefit plans, short-term plans. States have looked at outright banning those and limiting consumer choice. The Trump administration has issued some new rules on health reimbursement arrangements and health savings accounts, and we're looking at trying to find some ways to make sure that those are memorialized and protected.
Great. For someone who might not be super fluent in the lingo of HHS, can you explain some of those things to me?
You bet. So a short-term plan, it allows consumers, it's a non-ACA Obamacare compliant plan, and allows consumers to have a plan for a period of 3 years, up to 3 years, and they have a lot more flexibility than are available in the ACA marketplace. HRAs, health reimbursement arrangements, those are arrangements where an employer is allowed to contribute to an employee and allows the employee to access that account to help pay for their health care. And there are some new rules the Trump administration issued very recently that allow a variety of options. Those accounts be used for a variety of options for their employees.
Really interesting. So why are states trying to ban this? It seems like kind of a good thing.
I think states like New York and California, they are so wedded to the Obamacare marketplace that they see any choice as a threat to that marketplace, despite the fact that the market is crumbling in a number of those states, and that costs have gone up dramatically. In my home state, for example, a individual plan runs around $600-700 a month for a consumer to be able to buy. Consumers need more options. In short-term market, the HRA market, and other markets will help consumers be able to make their own choices. It allows the consumer to make the choice instead of the government making the choice for them.
Right. So what are the overall benefits of consumer choice here? What makes that so good for the market?
So in most cases, it's a lot less expensive for the consumer. It allows them to right-size their benefits based on what their particular needs are, what their particular concerns are. And it also allows a competition in the marketplace. In a lot of states, there's only maybe one insurer offering coverage. They're forced to buy from that insurer, and they don't have any choices as far as their doctors or anything else as far as that goes. So they lose their freedom to be able to choose their own medical treatments.
Huh. I understand you have some experience working in the States on some of this stuff. Is that correct?
That's correct. Former deputy insurance commissioner in the state of Wisconsin.
Cool. So how would you suggest that states go about handling issues like this?
I think they can talk to the industry. I think you have to be careful that the rules, administrative rules, are there to be rules to make sure everybody's playing fair, but that you aren't restricting choice and competition in the marketplace. Competition is the ultimate consumer protection. I think that's what people forget.
Great. Just one last question for you. If you had one message that you guys were bringing to this meeting that you could give to state legislators working on these issues all across the country, what would you tell them?
I think I would tell them, make sure that your consumers are able to make their own choices, that you're not substituting government choices for the consumer's choice.
Thanks so much, JP.
Thank you.
Have a great day.
You too.
We'll be right back with ALECTV.